This is a great program. You get exposure here like none other. It's a tertiary hospital in a big medical city. You get open exposure, which is a dying art, as well as endovascular exposure. And for me, when I was making these decisions, that's what stood out to me here.
Some vascular surgery residency programs end up being 7 years because they have a mandatory 2-year research training requirement. We do not have that. So someone could come here, get very well trained, and be an excellent clinical vascular surgeon in 5 years. We have a small program, 1 trainee per year, so we have a total of 5 residents, and that means that each of them gets a lot of attention. We're out to graduate people of high quality rather than worry about the quantity of trainees that we have.
Vascular surgery is actually one of the most technologically advanced fields, and that's part of what drew me into it.
We really focused on staying at the cutting edge of vascular surgery, and that to me means a lot of very specific things. First, we have a very high quality endovascular suite, so we're able to do complex endovascular procedures without any problem. Other facilities may transfer patients to us, and they often do, but we don't transfer patients anywhere. We feel like we're capable of taking care of any vascular surgery problem, however complex. Twice a year, we have a cadaver lab where the residents are able to operate on a cadaver and gain knowledge of anatomy and exposures and that sort of thing. We also have an endovascular simulator where they can practice endovascular procedures. So that helps to, give them confidence when they're actually in the operating room. We have a philosophy, all of us faculty here, of really trying to stay ahead of new developments in our field. As they go through the program, they're given more autonomy, more decision-making in terms of managing the other residents.
Resident-to-resident training is a great part here. The more you see, the more comfortable you're going to be staying on your own 2 feet outside of residency.
All of our residents every year have graduated with way more than the required number of cases, more than 30 open aneurysm cases just in their 5th year alone. I think this hospital had a very long-standing commitment to excellence in clinical service to patients and teaching of residents. And that's a culture that spans all the training programs here.